first, let's hear a little bit more about when I asked you about safety. What
safety?
or safety, or even how you envision your birth. Who's going to be there?
Well, just the two of us. We hadn't really envisioned having too many more people.
Maybe
and
not
of course,
at
the
the
midwives
birth per se,
at the
but-
actual
Or
birth,
in the labor.
in the labor.
Afterwards,
And for me, safety is in terms of, I guess I would say, interventions.
Maybe something went wrong, you mean?
Yeah, and I'm not fully aware of if it would be the same interventions at home offered as it would be in the hospital. I guess I would say medical or whatever is necessary, surgical or what have you. So that comes to mind for safety.
Okay, all right. So the equipment and the types of things you can do to address a complication.
Exactly.
Am I understanding what you're?
Yes, if there's a certain
saying?
urgency or something. Can it be dealt with at home? To what degree? I would say.
And then to what point would you go to the hospital if you were to be at
Yeah.
home?
When? How do you make that decision?
How do you make a decision?
Yeah.
Who makes
What-
the decision?
Sure. Yeah.
Yeah.
Because there's going to be a lot of
Right.
probably intensity going
and
on.
time,
So
yeah.
It seems a little overwhelming, I guess, to think of all those things. I feel like it would be a little bit simpler just to be in the hospital. Is sort of how I would potentially lean. Just maybe not being as aware of what the home birth
So let's talk a little bit about the things that can arise unexpectedly in pregnancy and labor. And again, I'm putting this in the context of someone who is at term, who's full term, healthy, no blood pressure problems, no problems with, so nothing in the medical history that would suggest that additional. So someone like yourself, someone who's healthy, fit, and once you get to term. In that case, there actually aren't that many things that happen unexpectedly in labor. There are a few things that you can't anticipate, and the most common ones being things like bleeding after the baby's born, when if your uterus is a little tired. Doesn't happen very often unless you have a very long labor or you have there are some things that increase your risk for that. Say we're carrying twins or something like that, but we don't do twins at home. So again, it's the correct thing, and the evidence says that if you have measures to control bleeding postpartum from the uterus, from where the placenta came out, that's a really important thing to increasing safety wherever you are, home, hospital, birth center, Africa, or Canada, right? A method to monitor the baby's heart rate and your vital signs to make sure you don't develop any kind of blood pressure or something that would require some attention or medication. A method to make sure your baby's heart rate is also, the baby's tolerating and responding to labor in a good way. We know that labor can be maturing for the baby also. There are all kinds of chemicals and catecholamines. And do you know what the word catecholamine is? In each setting, we have to really talk about both settings. So, the things to control bleeding, if we talk about postpartum hemorrhage, what do? You have to have someone there who knows how much bleeding is too much bleeding. You have to have usually in that situation you would provide a medication, usually by shot, sometimes by an IV, to help the uterus clamp down, which is the most common reason for bleeding postpartum is a uterus that doesn't clamp down soon enough. It's not a very common complication, but when it happens, that's what you would do. In order to handle that, you have to have someone who knows how much bleeding is too much bleeding. Anybody who attends birth needs to be able to do that. So the first answer for that particular complication is that in a planned home birth, we're talking about carrying the same medications that we'd use in the hospital for term pregnancy. We have to control bleeding at home. Some people have a tear in their vaginal area and they need suturing. We carry that suturing equipment. The midwife, anybody who attends a home birth, will also carry resuscitation equipment for the baby and some for yourself, although that's not as common, right? But certainly what we call an ambu bag, a bag to provide ventilation for the baby as well as oxygen if that goes beyond, and the things to provide suction. All of that is the same exact type of equipment that we have, whether you're home or hospital. And every birth we go to, we set those up. Most of the time we have to put them away because we don't use them or they expire, not because, we use them, but they're always set up as part of the home birth setup. So we're not talking, when you're talking, so there's actually been quite a bit of research around what happens, so we have this sense that birth and labor and birth is an unpredictable event, but for the most part, for someone who's healthy, it's a normal physiologic process that your body's going to go through, and with a bit of vigilance and communication between you and your providers, whether you're home or hospital, if something is going outside not normal, and that we know by listening to the heartbeat, taking your blood pressure, listening to you, watching how often your contractions are coming, seeing how you're coping with labor, seeing how you're working together, all of those things are the same wherever you are. And it should be remembered that usually people don't go to the hospital right away. You spend some time laboring in your own home. So what probably both of you need to talk about and think about is how are you going to set up your own home, regardless of where you have you, to be comfortable for that. And it might, we as midwives will come to your home when you're in active labor and help monitor the baby, your progress. I mean, in this province, most of the midwives do that's what they do. They will do labor support at home, even if you're planning a hospital birth.
Oh, okay.
And
So
then-
they'll come beforehand. And,
That's right.
Okay.
That's right. And we will come and help you decide. And part of that is because we have limited beds in the province, available. So. The province recently started to fund the supplies for planned home birth, the supplies that the parents have. So in the hospital, when you go to the hospital, they will give you pads, sandwich pads for afterwards. All the disposable supplies to keep things clean underneath you. The initial diaper for the baby and a little t-shirt for the baby. And one of the things that all of us are concerned about is to make sure that there are enough beds for those women who really need them, the women who have risk factors, right? So the one of the ways that we are trying to support women's choice as well as be socially responsible for allocating the resources is to encourage women to not to go to the hospital too soon.